The problem to be addressed in this project relates to the limited time healthcare workers have in treating patients, with the additional pressure to continue to monitor, assess, and treat patients effectively. The time-consuming manual process of acquiring and recording patient vitals and initial diagnosis can lead to delays for those in need of urgent care, increase the workload for healthcare staff, and human error. To address this, the introduction of the Smart Chair can aim to bring a solution. This system is a sensor-equipped seat that monitors a patient's vital signs: heart rate, body temperature, respiratory rate, and blood pressure. Additionally, an interactive screen will be implemented allowing patients to enter symptoms, and all the data collected is then delivered to a medical expert system for preliminary diagnosis, and results of the pre-analyzed data will be sent to the doctor, achieving improved speed and accuracy, as well as an increased time for the doctor to spend on more critical tasks. Established goals. 1. The prototype system will successfully link to a medical expert system database and be effective in interactivity and guiding doctors to possible illnesses suffered by the patient. 2. Prototype interface is functional for user use, where users are able to input their symptoms and be directed to possible illnesses. 3. Suggestions made are accurate. 4. Prototype runs without broken queries. 5. Sensors to be included in the design address the main vitals that doctors gather upon meeting the patient. And 6. User-friendly for all varying ages and technology skills. After testing the system, the prototype is definitely far from completion in regards to the UI and UX. This prototype is user-friendly to varying age groups and technological knowledge due to its simple design and larger fonts. Limitations lie in the inconvenience of the new proposed method of taking in patient input, where the original idea of the patient typing in all their symptoms to be processed had to be changed to using IDs for different symptoms to avoid possible spelling errors that may occur. This can cause the system to be unable to accurately pinpoint the correct answer. It would be time-consuming to look through a list of symptoms or diseases and end up not solving the enterprise problem at hand. For future implementation and improvement, possibly a chat box could be included and allow patients to enter in their symptoms and, regardless of errors, be able to recognize what symptoms the patient is referring to, and from there collect data of diseases that have those symptoms and send that information to the doctor. Another aspect I would have liked to include was a sign-up form that would prompt patients to give their details, like their name, appointment time, and record the patient's vital readings that would have been taken by the implemented sensors in the chair and their noted symptoms. All this information would then be sent to the doctor to be looked over.